Hey everyone, welcome back to another episode of Health Corner. I am Dr. Shalom T, and today I'm going to be answering this common question I've always had. How much blood loss is normal after a C-section versus a normal vaginal delivery? And I want to answer this question first by sharing a story with you guys. This was something that happened in med school. I think this was like one of my most traumatic experiences, and I've never been able to forget. So it was this 35-year-old lady. I think she was about 35, yeah. She came in because she was pregnant and she was in labor. Unfortunately, labor wasn't progressing very well, so it ended up in an emergency cesarean section. She gave birth to two beautiful, to a set of twins. But this story had a twist. After she gave birth, they put her on fluids and they took her to the ward, so that she stabilized and everything. When she got back to the ward, because she was operated like at 7 p.m. I think in the night, right? So when she went back to the ward, she started bleeding around maybe I would say like 1 a.m. and she thought it was like normal bleeding or something. So she was bleeding and she was restless and she was weak. She was losing so much blood, but it was like late in the night and they had already done all the checkup and she was all right. So in the morning, we always have like these rounds that we do as students. You come and you see your patient, and when the doctor comes, the doctor allows you to present that patient or present the case. So a medical student now came early that morning to come and check on the patient. And when they came, they noticed that this lady was extremely pale. By pale, I mean like white, because she had lost so much blood. The bed was covered in blood. Her pad was covered in blood. She was just restless. She was feeling weak. She was kind of agitated. And when this student saw it, the student knew that this is like signs of shock. This woman is getting into shock. This lady was surrounded by her friends, her family, but they never knew what was normal and what was not normal when it came to like bleeding after delivery. So this student rushed immediately and called the doctor, who was actually doing rounds in another ward. I think I was in like the 4th or the 5th year at the time. So all of us ran, because it's like a bunch of students. So we ran into the other ward to go and see this lady. This lady had bled so much. She was sweating. She started to agitate because she was already getting into shock. The doctor tried his best. He put in fluids. We drew blood, to take to the lab so that we can do like a cross match and then get her blood. It's not like the system here where all those things are like immediate. It takes some time. So as there was all that back and forth, this lady was literally decompensating. And before the blood came, this woman died. This lady died surrounded by doctors, surrounded by medical students, surrounded by everybody doing their best, because at the time she had already lost so much blood. I mean, we watched this woman die. It was so, as a doctor, you see a lot of patients die, but this particular day was so painful because she just gave birth. Her family, what about, the twins that she had? But unfortunately, that's what happened. I'm sharing this story with you for 2 reasons. One, so that you should know how important little details like this are. You can blame the hospital, you can blame the caretakers, whoever you want to blame, you're right. But I believe that when you know better, you do better. You have to pay attention to little details like this, and that's why I want to teach you all that you need to know when it comes to bleeding after delivery. The second reason why I chose to share this story with you is to call the attention of family members, caretakers. Whenever a woman gives birth, I know that you are happy, you're excited, the baby is here, yes, there's all of that, but the baby is there. I want you to always pay attention to the mother, because most of the time when the baby comes, people forget that this woman has been through a lot. Her body is trying to balance, she's bleeding, she's in pain, there's so much. I want you to pay attention to the mom as well. Make sure that she's okay. Make sure that if she's bleeding, monitor the bleeding. How quickly does she have to change her pads? Is she okay? Is she developing a fever? Just look out for the mother, okay? So back to our question, how much blood is normal after a vaginal delivery or after a C-section? What you need to understand is every woman bleeds after delivery. It doesn't matter if you had a C-section or you had a normal delivery, every woman bleeds. This is called lochia. It is simply shedding of the uterus, blood, that is coming out to just get your body back to normal, the process of healing, right? So you're going to experience bleeding. The issue is with a C-section, you lose blood as well during the surgery. So aside the normal blood that you're supposed to lose after a delivery, you lose some in the theater. That's why we say women who had a C-section bleed more than women who had a vaginal delivery, because there is some level of blood loss in the theater. But after this, you're supposed to bleed normally. So what is the normal? For the first 3 to 4 days, expect to see bright red blood. It can have clots as well as it may not have clots. Expect to bleed heavy, so you may have to change these heavy duty maternity pads within 2 to 3 hours that first 2 days. That is completely okay and that is normal. After that, from day 4 to about day 14, the color of the blood is going to change from bright red to like this pinkish brown or light pink color. It is not going to be as heavy as the previous days, and this could last for the next 10 days, 12 days or so. After that, we have the last phase of bleeding, which is called lochia alba, and you can expect like this yellowish discharge, and it can last for up to 2-3 weeks. Some women, the entire process from the bright red blood to like the yellowish discharge takes about 3-4 weeks. Other women, it can go for up to 6 weeks. That's the normal. Now this is what is abnormal. If you notice that you're bleeding so much and you have to change these heavy duty maternity pads every 1 hour, that is a red flag, serious red flag. Make sure that you notify your caretakers, notify the healthcare professionals that you have around you. The second thing is, if you're bleeding with heavy blood clots, if the clots are bigger than the size of a golf ball or like bigger than the size of a medium tomato, right? This is a red flag. Let your healthcare provider know immediately. Another thing is, if you were bleeding normally, right, and you notice that the bleeding has slowed down and is changing colors as I have previously explained, but suddenly you started to bleed heavily again. It doesn't matter if this happens immediately or if it's happening after 2 weeks. This is a big red flag. Please immediately call your doctor, talk to your nurse, talk to someone. Don't sit and think that, oh, it's because I did this. No. Get help immediately. And finally, if you notice that the blood is starting to smell foul or it's starting to smell fishy, this is a very, very big red flag. Don't sit there and ignore this. Make sure that you get help immediately, because your system at this point is very, very fragile, and any little thing can cause an infection, which can cause that foul smelling discharge that you're getting. So if you get any foul smell or anything that doesn't smell like blood, make sure that you get help immediately. This is also why we encourage the 6-week wait, because I feel like most of us women don't even really understand what is going on in our bodies. You just gave birth. The placenta had to detach. There's a wound on your uterus that is trying to heal. Your baby had to pass through the canal to come out. Your vagina is healing. Maybe you had stitches and all of that, right? You want to make sure that your body heals. If you even had a C-section, you even have more wounds that need to heal. So you don't want to introduce any foreign bacteria into your system. That is why you have to wait. That is why you have to wait. Let me say it again for the second time. I get that you miss your spouse. Sometimes, even us as women, you can feel that your body has healed completely. No. But give your system time so that you don't introduce bacteria and make things complicated. I hope this was able to answer your question. If you have any more thoughts, comments, or even questions about this topic or another topic, leave them down in the comment section. I'll be happy to hear from you, and I'm going to respond as quickly as I can. Don't forget to follow me on all my social media platforms. Thank you so much for tuning in today. Till next time, bye-bye.